When the pandemic commenced, Alison was indeed the right person in the right place, in the right time in the Department of Health, with the combination of experience she'd had through disaster management and OSMAT and various other roles. Alison had a depth of knowledge that far eclipsed that of many of her colleagues within the department at the time. Alison will also be familiar to you. You will have seen Alison doing a lot of press conferences during COVID, and Alison's work has been recognised by the International Council of Nurses. She's been acknowledged as being one of the most visible and influential nurses in the world during the COVID pandemic.
I've been a nurse for 40 years. I trained in the United Kingdom. I moved to Australia in the late 80s. I did most of my clinical experience and work at the Austin Hospital in Melbourne, and then into management, and then I worked for a considerable time in the Department of Health in Victoria. And in November of 2019, I became the Commonwealth Chief Nursing Officer and Midwifery Officer, and I now work in Canberra. And I came to the job just before COVID started, which has been a little bit of a wild ride, to be honest, but also an enormous privilege to be a part of what has been a monumental health impact and, of course, an impact on all our community. I'm going to talk today about the voice of nurses and midwives in the decision making, but one of the things I want you all to think about is, do you actually know how government works? Because in order for us as professions to be able to influence, have a voice and be a part of the future, you need to understand who you're talking to and how the systems work. And that's a very big part of what I do, is to help many organisations, nursing and midwifery, understand government and understand how to get heard, how to negotiate, and how to get those messages across. What we often hear, particularly from nurses and midwives, is that they don't feel that they have a voice. And so what I did in my talk this morning was I explained firstly what the role of the Chief Nursing and Midwifery Officer is, that I'm a public servant, and then also how I bring the voice of nursing and midwifery to the table, but that how I also can facilitate that through a whole lot of other structures. And there's a lot of work going on at the moment there's a new strengthening Medicare task force, and there's a national health workforce task force. And these are structures that are looking at the workforce in health across the system. And we have a very strong representation of nurses and midwives in these structures. And I'm working across, of course, the enormity of more than 430,000 nurses and midwives in Australia to make sure that that voice is heard. But there's a real focus on not re-prosecuting always the problem, but looking for the solutions, for the ideas about how we can bring about change to improve the situation that we have and grow that resourced, well-resourced, resilient workforce that we need for the future. My entire time as the Chief Nurse and Midwifery Officer has been almost completely during COVID. And it is the best job I've ever done. I work with some of the most amazing people, and I've been privileged to be a part of some of the big decision makings. I'm a member of the Australian Health Protection Principal Committee. The role of the CNMO is a permanent role on that. So when you hear in the media and they say, oh, the chief health officers made this decision and the chief health officers did that, be reassured. There is nursing and midwifery voice at that table as well. And on many occasions in the last 2.5 years, I've chaired AHPPC. So we can and do often sit at the very highest level of decision making, often when those decisions were incredibly difficult to make. The pandemic has been the largest circumstance or situation across the world that most of us have ever seen in our lifetime. Some people, of course, lived through the Second World War, but there's not many people left of that time. So this had an impact on every part of our lives. And I think that for the health workforce, and particularly for the nursing workforce, there's been a strong focus on the critical role they play, and they've been stretched in so many ways. But also, I think it's important to remember that nursing is predominantly a female-dominated profession. So a nurse is not simply a nurse, but also is often a wife, a mother, a caregiver, and has had to navigate all that wearing of PPE, all of the furloughing, the lockdown, the challenges of just delivering care in a way that's still empathetic to patients during the pandemic. So ultimately that has an impact on everybody's mental health. And what we're saying is that it's good to reach out for help, that it's important to do that, and it's a strength, and we should have confidence in ourselves to seek and talk to people if even there's just a sense of a bit of lowness or loneliness or whatever it is. Seek help, because it really does make a difference. We work in every aspect of health and aged care, from birth to death and everything in between. So we as a profession, particularly in nursing, have impact on every part of the system. And we need to help those that don't necessarily see that nurses particularly are the linchpin of our health system, and without nurses there will be no health system, or there cannot be any health system. And that's partly my role, is to help people understand how you make an incredible difference to the lives and outcomes of many people every day, and will continue to do so. For me, the most important message I can give to nurses, or all 430,000 of nurses and midwives in Australia, is be proud of what you do. Be proud to say what you do, and encourage others to see and understand the work that you do. We work, as I've said today in my speech, that we are there at birth and there at death and everything in between. So I think that we as a profession need to celebrate what we do and be proud of what we do, and what all nurses do and midwives is make an enormous difference to people's lives every day.